My name's Tim Newton. I'm Professor of Psychology as Applied to Dentistry at King's College London, which means that I'm very interested in looking at how behaviour influences our oral and dental health. It's always been important for clinicians to discuss patients' behaviour with them and how that affects their health. But now that patients have so much choice and availability of different things that they can do which are both healthy and unhealthy in regards to their oral health, it's even more important to think about ways we can support them to make those healthy choices. My three key principles for creating habit change in patients would be to provide cues, to ensure that they repeat the behaviour, and to get them to reward themselves for behaviour. So for example, if I want a patient to use a mouthwash, I would provide a cue, usually by giving them a little bottle of mouthwash. I'd get them to review it regularly and to repeat it, so get a regular pattern at the same time of day of using this mouthwash. And I'd get them to reward themselves for doing it. So if they get a pattern of successful days, then they give themselves a little reward. And for healthcare professionals, those three key principles are exactly the same. Try to build in a plan of when you're going to deliver your oral hygiene advice. Repeat it, so try and do it every single time for every single patient for every single day. And if you're successful, find a way to reward yourself for doing it. Your rapport with your patients is the fundamental foundation of behaviour change. So a patient has to have some kind of relationship and trust in what you're saying. I think we're already at an advantage with that, because with healthcare professionals there is a kind of assumed trust, and we're also very credible as sources of information. But taking time to get to know your patients, what are their goals in life? What do they want from their oral health? What are the things that they would value about their smile and their teeth? And then using those as a basis for saying, well, if you want to have these things, let's work together to get your behaviour so that you can work towards those goals. I think that's fundamental. It's a shift from thinking about curing disease to managing the patient's health. So sometimes patients will challenge us that actually our health advice seems to be changing, and that what we advised once, we don't advise anymore. But I think our response to that should be that the evidence base is constantly changing, that we keep up to date with that evidence base, that actually if they do internet searches and so on for trusted sources, they'll see why the evidence base is changing. We're moving on and things constantly develop, and what becomes best practice changes.